An opiate is actually a naturally occurring substance that's derived from the poppy flower fruit. It's been around for thousands of years and used predominantly for alleviation of pain. It's addictive because we develop tolerance to it, and actually biochemical changes occur within the brain. And the short-acting period of time that the opiate works creates tolerance very rapidly.
In our survey, we found that there was no particular demographic that stood out. We were kind of expecting a spike in the age group around 20 to 30 years old, but it turns out 46 years old was the average. And we think that as the population is getting older, that more people are seeking treatment for chronic pain conditions like lower back pain. And a lot of them are being prescribed opiate medications, and some of them are becoming addicted. Unfortunately, the CDC tells us that 46 people a day die from prescription opiate overdose. So it's a serious problem.
The demographics of opioid addiction stretch, as Tim alluded to, across the full range of ages, both genders, all economic strata within our society.
There's a lot of misinformation out there about opiate addiction, and we wanted to find out from patients exactly what kind of issues that they're coming across, what kind of challenges they're having, not only in finding treatment, but also in staying in treatment, in reimbursement issues, and any obstacles they have to the dosing itself and the medication. There really wasn't any kind of body of evidence out there that actually asked the patients. There was a lot of assumption and a lot of what we found out to be misinformation.
That's a great question, and it's not actually difficult to treat. There's very successful treatment plans that can allow patients to maintain stable, sustained abstinence. But if it's treated in a short period of time, it does have high risk for relapse. This is closer to a situation like diabetes or high blood pressure or asthma, where you need to have a continuation of treatment and interaction with your healthcare professional for there to be successful outcome. It really does not work very well for an individual to go somewhere for a weekend or for a week or even 30 days and expect they can come home to their same environment and not have high risk for relapse.
There's a few different ways to treat opiate addiction. One of them has to do with medication. And the idea of the medication, and I want to point this out because a lot of people, when they hear medication and addiction, they think that we're switching one addiction for another. But that's not the case. What the medication, when we're in terms of addiction, what that does is it suppresses the cravings and withdrawal, which allows the person to engage in the counseling and the therapy and the other behavioral aspects of addiction treatment. And that's really the meat of it, because recovery is essentially a self-reconditioning process, and the medication really makes that possible. Now, there are different varieties of medication. Now they have some that go under the tongue, some that go on the side of the cheek. They have different side effect profiles, but there's a discussion guide that we have on our site that kind of touches on this and helps people understand what kind of questions they should ask their doctor about it and kind of prepare for the office visit. You know, the federal law limits how many people a doctor can help with this medication at any one time. And the problem with that, right now, it's limited to 100 patients, and that's regardless of how many people are on their waiting list or how many people are dying. In fact, it's rare now that I don't talk to a doctor that says that he hasn't had an experience with a patient dying while on the waiting list. And the only thing that came in between that person getting help was this legislation that limited how many people he could help. So that is a very troubling result. We have a matching system that helps people connect with doctors that kind of mitigates this somewhat, but we still end up with patients having difficulty finding treatment. Our survey showed that 40% of people who sought treatment took weeks or months in order to find it. Other people had to resort to the diversion market in order to buy it. I've had parents tell me that they bought diverted medication for their son or daughter because they couldn't find legitimate care. So this is the result of this limit that we have on providing life-saving care.
Well, and this is the only medication in our country that has a limitation on the doctor's care to patients with it. You know as well as I that if you have transmission problem, you probably don't want to take your car to an individual that's changed one transmission. Usually we want to go to someone that's done multiple. In the same way, we as physicians many times have patients seek our care when we're experienced and we've had a track record of good outcomes assisting patients. And yet, as Tim alluded to, we are still limited at this point in time to 100 patients. If you do the math, that means I can only see about 2 patients a day in my 5.5-day work week that have opioid dependency. And the long waiting list, unfortunately, causes patients. I'm in Nashville, Tennessee. I have patients that come from Virginia, from Georgia, from North Carolina, from Kentucky, from Alabama, because of the lack of physicians in their particular home environment that either can provide care or that are qualified or able to provide care. So it's really created, unfortunately, when, as Tim mentioned, we have a surge, an epidemic even identified by the federal government with this problem, and we have new forms of treatment providing care, and yet we as physicians cannot provide that care. One, we can contact our federal government representative or Congress persons and let them know that we would like to see these limitations lifted. We can as well contact someone in our own community that's involved with healthcare or a healthcare professional if we have someone in our family that we are concerned about, or if we ourselves, in fact, feel that we have a dependency or we're abusing opiates.
Yeah, like we have the matching system that helps connect patients to physicians. They sign up, an email goes out to the area physicians, and they get a response to them. So it's a quick and efficient way for people to get help 24/7 when they need it. Also, on the same page, there's a guide, a discussion guide for patients that help prepare them for that office visit.
Well, I think some of the general guides, this is a family disorder, not an individual disorder. So if it's possible to not judge but consider wanting to help someone, then if we see changes, rapid changes in behavior, possibilities of difficulties financially, someone that is previously obtained prescriptions and they are now seeking additional medication because they cannot stop taking the medication, if they feel guilty about taking the medication. So there's several cues, but I would strongly urge and suggest to all individuals that they contact someone they trust and feel safe with in healthcare, whether it's a pharmacist, a nurse practitioner, physician, or a physician's assistant, and ask them whether they could bring their family member or they could come in for a screening and an assessment of the possibility of this being a medical problem.
And if you have a loved one who's addicted, or who you suspect is addicted, one thing you can do is start learning about it now and try to get the facts beforehand so that by the time they are ready for help, that you'll know exactly what to do and you want to spend time learning about it at that point. I would urge people to go to treatmentmatch.org where they can read the discussion guide, prepare themselves for the doctor visit, and then also get some of the educational information that's available at the bottom of the site.